Hi, the pathology disease I chose was hemophilia. Hemophilia is a disease when the blood is not clotting properly. Blood clots form in response to bleeding caused by injury. Matthew Hoffman explains the process of how a blood clot forms. He says that the parts of the blood called platelets are activated by the damage done to a blood vessel. They stick to the part that's damaged to form a plug to stop the blood from falling out. Then proteins in your blood called clotting factors speed up that process and create a long fibrin. The fibrin intertwines with the plug to create a clot. People with hemophilia have trouble making that clot because they don't have all of the blood clotting proteins they need. So it just doesn't happen fast enough and a lot of the blood's still leaking out. As stated by the National Library of Medicine, when factor 8 and 9 are deficient or dysfunctional, the intrinsic pathway of the blood clotting cascade cannot be appropriately activated, thus making the process of the blood clot formation deficient. Or in other terms, there's not enough of the blood clotting proteins, the factors 8 and 9, to make the blood clots fast enough. People with less blood clots proteins have a worse disease than the people who have like a little bit but not as much as they should. Hemophilia is an inherited disease caused by the mutation of these clotting factors being passed on. The Center for Disease Control and Prevention explains that the gene is located on the X chromosome, which is why it's more common in males because they have one X and one Y. If that one X is mutated, then they have the hemophilia disease. But on the other hand, if a female has one X, they don't have the disease because they have two X's and only one of them being mutated would not give them disease. They would both have to have the mutation. I have a little drawing to help explain it better. This is a carrier mother and a father with hemophilia. So the X with the pink is the one with the disease. So she's a carrier, he has it. And if they were to have a daughter with the clean X and then the one that's mutated, she would be a carrier. But if it was both of the mutated X's, the daughter would have hemophilia. If it was the normal X and normal Y, normal son. Affected X and normal Y, son with hemophilia. Hemophilia has symptoms that can't be immediately spotted. Sometimes you don't know until they're kind of bleeding and it's not being clotted fast enough and just kind of bleeding out. It can be extremely dangerous and harmful to the person. There is some instances where it can be immediately spotted at birth. According to Dr. Mandel, a baby with hemophilia can be born with extensive head bruising or hematomas, which is bleeding in the birth. Other common symptoms you might see throughout their life is nosebleeds, heavy periods in females, bruising easily, joints, and swelling pain. Most people with hemophilia aren't too worried about the external bleeding because you can usually spot that and be able to fix it fast enough. I mean, sometimes you can't, but most of the time, if it's like minor, you'll be able to fix it and get it stopped. But what they're really concerned about is the internal bleeding. Internal bleeding can't be seen. So if you have internal bleeding, the blood could get into joint spaces and all in your tissues, and it can damage organs and be life-threatening. And you could never know until you see that joint swelling or the bruising. There is no cure for hemophilia, but there are some treatment options. These treatment options include factor replacement theories, antifibrinolytics, gene therapy, and siRNA technology. Most people infuse themselves with a blood clotting protein on a regular basis. A newer treatment for hemophilia is the siRNA technology. Scientists Chumbra and Dermott state siRNA technology make it possible to tip the scales in the other direction, towards clotting. It rebalances one of the anticoagulate proteins. Instead of adding what is missing, it makes it balanced. It's supposed to help with people who bodies like to reject the infusions of the factor-based proteins and create immunities to them. Thank you.